please explain, Joanna, what you meant in your book when you said the expansion of the concept of bipolar disorder has been one of the key strategies employed to expand antipsychotic use into the wider population?
So bipolar disorder is the new name for something that used to be referred to as manic depression, and it was a very rare and very obviously recognizable condition in which people became very manic and aroused and overactive, or become manic, aroused and overactive for at least weeks and sometimes months at a time. And they usually do crazy things, don't sleep, do all sorts of damage and end up in hospital. So that wasn't a condition that was really of very much value for a pharmaceutical company. But in the 1990s, people started to talk about the use of drugs for this condition as mood stabilizers. And the concept of a mood stabilizer and the sort of concurrent concept of unstable moods suddenly opened up a much wider group of people to the sorts of drugs that were then being prescribed for manic depression. And the manufacturers of the atypical antipsychotics realized this and set out to position their drugs as mood stabilizers so that they could get into the mood stabilizer market. And then they started to expand the notion of bipolar disorder itself. So in what they referred to some research which had been done by psychiatrists suggesting that there were other forms of bipolar disorder other than the very sort of characteristic classical form, and these were referred to as bipolar 2 or bipolar spectrum disorder. And the drug companies took these ideas and really came up with this new idea that bipolar disorder consisted of being up and down with your mood, having mood fluctuations, being very confident one minute and very anxious the next minute, being productive one day and unproductive the next day. And this sort of concept, of course, could be applied to almost anyone. And they knew that, and they knew that if they could come up with a concept that was really flexible, then they could get into that market for antidepressants and get to the much, much larger number of people that go to their doctors with more ordinary everyday problems than the classical manic depression.
Can I just add to that? And you might be wondering, well, why would my doctor buy into this kind of reshaping of a disease by the pharmaceutical industry, which is taking maybe the normal ups and downs of mood, reshaping it so that it's a disease that requires an antipsychotic? And I can tell you, of all of the specialties I've looked in this book, Selling Sickness, psychiatry is probably the one in which the ties between the doctors and the drug companies are the strongest. And you've got major conferences sponsored by the pharmaceutical industry that makes antidepressants, anti-anxiety drugs, antipsychotics. And the wining and dining and care and feeding of our physicians by the pharmaceutical industry when it comes to mental health, particularly psychiatry, is probably one of the biggest scandals in medicine. And the APA has been described as one of the marketing arms of the pharmaceutical industry. I went to a psychiatric, an APA conference once, and I can tell you it was like a circus. These big conference halls where the tables with all the vendors and all their drugs and all of the displays and the free gifts and just the schmoozing between the salespeople and the doctors was something that I found so amazing and amazingly offensive at the same time. So when your doctor gets ideas in their mind that what you have is something that can be treated by a pharmaceutical, by an antipsychotic or an antidepressant, it's quite likely that that message has been planted very firmly by these kinds of conferences and the specialists that they support and the research that they do.
And the APA is the American Psychiatric Association.
Just to add to that, I think the influence of the pharmaceutical industry is slightly less in the United Kingdom. but it is also tapping into a vulnerability and insecurity among people. So people are increasingly being told that if you have problems in life, go and see your doctor. There is an answer. I think you were referring to this earlier. It may be, you may end up with a label of depression, you may end up with a label of bipolar disorder, depending on the flavour of the month or what drug rep has visited recently. But there is that vulnerability and out there that the pharmaceutical industry is playing on.